Hello everyone. Why am I here? Who are you? Oh, I don't understand here. These are the symptoms of Alzheimer. You will forget many things. I will tell you later. So here's the table of contents. First of all, I will tell you what is Alzheimer. And then I will tell you how to cure or just ease the symptoms of Alzheimer. So here's my table of contents. You can take a look. So let's do this. Do what? I forget. What is Alzheimer? Okay. So what is Alzheimer? Here's the definition of Alzheimer. Before you start to note down or find so many words here we don't want to see, I know you don't want to see. You don't even need Alzheimer to forget about this after I finish it. So if I'm going to conclude Alzheimer in one word, it will be forgetting. You will forget many things, like forget how to remember, you will forget who you are, you will forget how to become a normal person. You will forget how to be calm. Alright, so here comes the difficult part. Alzheimer is the disease because of amyloidosis. There are many kinds of protein in our brain, right? And two of them are beta amyloid and tau protein. These two kinds of protein will first help to stable our neurons. However, if they are folded in a different way, a wrong way, it will be very sticky and it will make the plaque. So it will stuck your neurons and then you will start to forget about the things. Why can they move to many places in our brain, move around, hang around? It's because the low density lipoprotein receptors, it can help these two kinds of proteins to transfer from neurons to neurons. Alright, so we finished it, yeah. So let's come to the lecanemab. It's a new kind of medicine to ease the symptoms of Alzheimer. It's very similar to the medicine we had talked about, Aduhelm. What's the difference between them? Aduhelm only have the accelerated approval, which means FDA think Alzheimer is a very serious problem, and we still don't have the medicine to ease the symptoms to save people. So they give them the accelerated approval. Before they finish all the clinical trial, they can sell the medicine to save people. But the problem is it didn't finish the clinical trial. So it has the problem to cause the intracerebral hemorrhage. Yes, hemorrhage. Up to 45% of patients who take Aduhelm will have this problem. It will cause a lot of death. So that's why we have lecanemab. It's actually from the same company with Aduhelm. It's from the Belgium. Alright, so it has the biological license applications, which means it finished all the clinical trials and proved that it is 100% okay for all the patients. So why is it so important? Because if it has BLA, the Medicare will help you to afford up to 80% of the cost. So it will be much affordable for patients. And the primary endpoint of the clinical trial on lecanemab is to prove that it can ease the symptoms and then it won't cause the death. It finished this job very well. But what's the difference between both of the medicine? The Aduhelm is the medicine which just attack the protein in your brain, because we just said the Alzheimer is caused by the protein, right? But there are also the normal protein in your brain, so it will attack the wrong protein which cause the thing I just said. But this time it just combine with the amyloid beta protofibrils and then make it lose the ability to struck your neurons and become plaque. That's how it works. And finally, the Rizati. This is not the medicine to cure Alzheimer, but this can ease the symptom of agitated depression, which is the symptoms of Alzheimer. The thing that causes the symptom of agitated depression is because the protein's plaque will cause the serotonergic pathway damaged, and then with the serotonergic pathway leak, you will have the serotonergic, the dopaminergic axis imbalance. And then with the Rizati, you will feel better on this part, and you will get the thing you need. And up to 90% of the patients who take this medicine become better. You might have the question, why not just give patients dopamine if they're in depression? Do you think it's work? Give them dopamine. Do you think?
No, it didn't.
No, it didn't. Because if you just give them dopamine, it will become like marijuana. It will cause the problem of drug abuse. So it's used to help your brain produce the thing you need, but not just dopamine. Alright. That's all about my part. Thank you.